will think about getting started. We got a lot to go over tonight. And people will continue to trickle in, which is great. My name's Patty Acom, and you are all here at the Climate Action Caucus tonight. We are going to have a discussion on climate change and health-related issues, so it's going to be a really interesting evening. We have a great panel of experts who are going to give us some background and understanding on the issue, and it'll be a great opportunity for those of us on the Climate Caucus to ask some questions and see where some opportunities are that maybe we can work towards some change and some improvements. And so I am honored tonight to be sharing this responsibility of chairing this meeting with Dr. Kelly Morrison, Representative Doctor. How do we do that when there's two titles?
Representative Doctor.
Representative Doctor. Okay, we have a doctor in the house, and thrilled to have her. We were also going to be joined tonight by Dr. Elise Mann, but she actually got called to work, and so unfortunately, I know we're super disappointed she's not here with us. But there's a lot to go over, so I don't want to take a bunch of time. I just want to let people know that we are on a bit of a time limit tonight. We have a lot of information, so we're going to kind of try to be as succinct as we can be. And for those people who are joining us in the audience, there are some note cards if you have questions to be able to fill out, and there's some staff that you can let us know, and we'll collect those. And hopefully at the end, we can get to as many questions as we have time for. And so with that, I'll maybe pass it over to Representative Dr. Kelly Morrison to introduce herself.
Well, welcome everybody. As Patty said, I'm Kelly Morrison. I represent 33B, which is kind of around the Lake Minnetonka area. I'm grateful to all of you for coming out tonight to learn more about health impacts of climate change, impacts specifically on public health. As a Minnesotan and a state representative, I'm very grateful to Representative Acom for chairing the Climate Action Caucus, and I'm excited for the work ahead. And as a physician, I'm particularly grateful that we're going to focus on the impacts of public health, because I think it's an often overlooked part of the conversation when we talk about the impacts of climate change. So looking forward to a great conversation tonight. I can't wait to hear from this esteemed panel of experts. Thanks to everybody for being here tonight.
And maybe with that, then we will begin with our first speaker, Kristin Raab from the Minnesota Department of Health.
Great. Good evening, everyone. It is a real pleasure to be here today to talk about the health impacts of climate change. And I'd like to thank Representative Acom and the Climate Action Caucus for inviting me. I'm Kristin Raab. I'm the director of the Minnesota Climate and Health Program at the Minnesota Department of Health. And my goal for this presentation is to impress upon you the seriousness of climate change and the need for immediate action to mitigate greenhouse gas emissions and to adapt to the changing climate that we're already experiencing now and will in the future, even if we stop our emissions today. We collectively can work hard to avert the worst climate change impacts by implementing innovative, job-creating solutions now. So before I begin, I just wanted to take 1 minute to talk about our program. So the Minnesota Climate and Health Program is a federally funded program from the Centers for Disease Control and Prevention to help protect public health in Minnesota and prevent further harms from climate change. We do this by educating people on the health impacts of climate change, researching how climate change impacts public health, and by building capacity through developing evidence-based tools and products to help others implement climate adaptation strategies. To start this discussion of the health impacts of climate change, we need to have a common understanding of what creates health. There are a number of factors that influence health and well-being. This graphic illustrates many of those factors. Our health is determined by individual factors like our age or gender, by individual behaviors like eating a healthy meal or getting exercise, living and working conditions like having a well-paying job, natural and built environment conditions like having clean air to breathe and clean water to drink, and social, economic, and political factors like dealing with racism, or even having decisions in the policies and strategies that affect our lives. All of these things affect our health, and climate change impacts almost all of these factors. Climate change is the greatest threat to public health in the 21st century. The Lancet, a prestigious public health journal, made this statement because no matter how divisive the issue of climate change has become, the bottom line is climate change threatens the very basics that we depend on for our life: our air, our food, our water, our shelter, our security, and our health. Climate change not only brings new threats to almost every sector of life, but it also exacerbates existing threats to our health and well-being. The narrative around climate change used to center around melting ice caps and polar bears. But we need to make the connection back to health, as it allows us to understand the real and tangible impacts here in our communities. Sometimes it can be challenging to see how climate change impacts our health. We use this framework to better describe how climate and health are linked. Starting at the top of the graphic and moving down, the release of fossil fuels into our atmosphere changes the atmosphere's composition, leading to increasing air temperatures and precipitation, especially heavy, localized precipitation events. And these changes are causing measurable alterations in Minnesota's air, weather, water, and ecosystem cycles. Changes in those cycles are affecting air pollution, extreme heat events, flooding, drought, and ecosystem threats such as tick-borne diseases and harmful algal blooms. These climate hazards, as we call them, air pollution, extreme heat, flooding, and droughts and ecosystem threats, are associated with a wide range of health impacts. Some of the climate hazards cause direct health effects, like heat-related illnesses from a heat wave, and some cause indirect health effects, like exacerbation of asthma from mold growth in flooded basements. There are a lot of direct and indirect health effects of climate change, so with the next few minutes, I'm going to describe a few of these. Extreme precipitation events have been on almost everyone's mind this year, and especially farmers who have had their crops decimated by flooding. Minnesota has experienced 18 historic mega rain events since 1858. Mega rain events are declared when 6 inches of rainfall fall over 1,000 square miles. So over this 160-year period, 10 of these events, so over half, have occurred just since 2002. Increased frequency and severity of heavy downpours can lead to flooding, which has a number of health impacts: physical injuries or even deaths from drowning, illnesses from being exposed to contaminated water, mental health stress from experiencing the event itself, or later from being displaced or dealing with a damaged business or home. Respiratory ailments from exposure to mold and basements, and carbon monoxide poisoning from exposure to carbon monoxide from using backup power sources like generators. Flooding is impacting the health and safety of people all around Minnesota. This photo shows a drinking water well 15 in Mankato. The majority of Minnesotans rely on their public water utility for their drinking water. This particular well provides 35% of Mankato's drinking water, and it is in danger because of extreme erosion from flooding. Since 2009, the riverbank has eroded approximately 60 feet, and 15 feet of that erosion has occurred within the last year. As of today, there is approximately 14 feet of land between the river and the fence around well 15. One more large rain event could be disastrous to this well and Mankato's drinking water supply. Not only is extreme precipitation threatening Mankato's health through their drinking water supply, this particular spot is an important historic and cultural site to the Dakota people, and it serves as their powwow grounds. Irreplaceable loss of culturally important lands can also cause mental health impacts. Moving to ecosystem threats, increases in temperatures and changes in rain patterns can disrupt our natural ecosystems, which can affect the spread of diseases from insects, ticks, and rodents, and can cause harmful algal blooms. MDH tracks several tick-borne diseases in Minnesota transmitted by the black-legged tick, including Lyme disease, anaplasmosis, and babiosis. This map shows the expanding geography and increasing incidence rate of Lyme disease in Minnesota. As you can see, from 1996 to 2013, there has been a definite expansion and shift west and northward in the state. A warmer, wetter climate is favorable to the growth and survivability of ticks and may help increase the number and spread of tick-borne diseases. In 2017, there were over 1,400 confirmed Lyme disease cases in Minnesota. So when we think of extreme weather events in Minnesota, we tend to think of winter storms or tornadoes or floods, but extreme heat events happen here too. An increase of extreme heat in Minnesota is a threat on the horizon, which we can start preparing for now. Extreme heat events can lead to dehydration, and more extreme type health outcomes can be heat stroke, which if left untreated, you can die from. Heat also worsens existing health conditions such as various respiratory and cardiovascular diseases. This is a chart that shows emergency department visits by age group. Just as one example of the health impacts of heat, in the summer of 2011, we had 6 days when the heat index was 105 degrees or higher. That same summer, we had 1,255 emergency department visits and 3 deaths due to heat. Finally, a quick review of air pollution. In Minnesota, ozone, pollen, and particulate matter are the air contaminants that we're most concerned about with climate change. These pollutants can have direct health effects such as causing or aggravating chronic obstructive pulmonary disease or COPD, cardiovascular diseases, allergies, and asthma. Climate change threatens to make unhealthy air days more frequent and more intense. For example, in 2018, there were 10 air quality alerts issued in different parts of Minnesota, which means pollutant levels in the air reached a level of health concern for sensitive groups, so those with asthma and COPD. 6 of those 10 were issued because of wildfire smoke entering our state from Canada. And for the first time since Minnesota began tracking air quality, an air quality alert was issued for the entire state due to wildfire smoke in August of 2018. Another impact on the air we breathe that is intensifying with climate change is pollen. Research shows the growing season for ragweed pollen, which is highly allergenic, has increased 15 to 25 days in and around Minnesota. This significantly impacts people that have asthma or allergies. The implications of a changing climate may seem pretty stark after we start looking at the realities that we're facing. But we can flip the threat of climate change into an opportunity if we all play a positive part in change. A few years after releasing its previous statement about climate change as the biggest global health threat, The Lancet published a glass half powerful statement. Now, more than ever, we have an opportunity, a necessity, really, to mitigate climate change and build resilience at all levels in the face of climate change by investing in green technologies that provide jobs, implementing policies that clean our air, protecting important assets that we already have, and by creating healthier and more equitable communities. Thank you.
And thank you, Ms. Raab, for that presentation. And I just went to have the caucus introduce themselves as we're getting started before we transition to the next speaker. So maybe we'll start with Representative Wagenius.
Jean Wagenius, representing South Minneapolis and Richfield.
Steve Sandell, Woodbury.
Jay Shaw, Southeast St. Paul.
Kali Her, St. Paul.
Leon Lilly, North St. Paul, Maplewood, Oakdale.
Jamie Long, Minneapolis.
Amy Waswick, Wiper Township, Wiper Lake, Delwood, North Oaks, and Hugo.
State Representative Kristin Bonner, representing Maple Grove and Osseo.
State Representative Frank Hornstein, representing parts of downtown and southwest Minneapolis.
Representative Ann Claflin from South St. Paul, Cottage Grove, Great Cloud Island, St. Paul Park, and Newport.
Zach Stevenson, Champlin, and Coon Rapids.
Raymond Dean, most of downtown Minneapolis and the southern part of North Minneapolis.
Robert Bierman, parts of Apple Valley and Lakeville.
And I think we have a couple that are on the phone. Maybe we could get them to introduce themselves as well. Maybe?
Kelly Christensen from the Stillwater area.
Anyone else? Excellent. Well, perfect. I just wanted to make sure everybody knew who was in the room. And with that, maybe we'll transition to Bruce Snyder.
Oh, good evening. Thanks for the opportunity to speak to you this evening. Thank you to Representative Acom and her colleagues for creating this caucus and bringing the issue of climate change and health further into focus for Minnesotans. I'm a retired physician. I'm a member of the Executive Committee of Health Professionals for a Healthy Climate. We are a Minnesota organization of nurses, doctors, pharmacists, veterinarians, and allied professionals concerned about the health impacts of climate change and associated pollution, as Kristin just explained. We recently responded to a request for public input by the U.S. House Select Committee's Select Committee for the Climate Crisis. And we had a number of policy recommendations, and I'm going to draw on that document, which was prepared by our executive committee, and particularly by Dr. Christy White. And I want to just emphasize some of these points, and then hopefully maybe some questions about them. So we first looked at measures that would be important for adapting Minnesotans and our Minnesota healthcare infrastructure and professionals to the changing climate environment. And I wanted to start with issues related to heightened vulnerabilities and disproportionate impacts of climate change on communities of color and low-income communities. And some of these challenges for those communities would include the digital divide, the lack of information which is available, issues relating to wellness checks, especially on isolated elderly and disabled during climate crises, enhanced challenges and the need for improved facilities in clinics and other and pharmacies and so forth serving these areas. We also wanted to look at the particular needs of rural communities in trying to manage climate and pollution related crises. So, for example, when we have a mega storm and mega flood, we run into issues of washing, pollution, and flushing out manure ponds into our waterways or aquifers and so forth. How do we handle that? How do we secure safe drinking water for these communities? I also want to look at the need to assess and possibly increase regulation of certain healthcare facilities. So, for example, do our nursing homes and chronic care facilities have adequate emergency backup power and hopefully clean power during a time of a climate crisis? Do our facilities, particularly those serving underserved populations, have the supplies and staffing to deal with prolonged weather and climate emergencies? Facility hardening may be necessary. For example, you may recall, I think it was in 2014, when Methodist Hospital was backing up to a flooding Minnehaha Creek and had to put up 6 feet of sandbags in their parking lot to protect their data center on the lowest level of the hospital. And by adaptation of facilities, we can raise questions, for example, should our data centers, electrical contacts, and plumbing all be located in the lowest level of the building? And for that matter, should the air intakes be on the ground level? So we need to, I think, look at this and reassess it. The Department of Health and the Pollution Control Agency produced a report on Minnesota climate vulnerability. I think that was 2016. Thank you. And it's a very interesting report, and I recommend that you all look at it. One of the things that struck me was that asthma hospitalizations are actually highest in rural counties outside the 6-county metropolitan area. And an aspect of heat stress, which Kristin did not mention, is agricultural workers and outdoor workers and athletes. In periods of sustained high temperature, the risk of kidney disease goes up quite a bit in these populations. So this is something that affects a lot of people, or can affect a lot of people, and we would do well to both adapt to that and do what we can to reduce the risk. I also want to talk about mitigation, which refers to our efforts to urgently reduce our carbon emissions and emissions of other pollutants. Specifically, I'll deal with healthcare facilities. So, for example, we want to forward low-carbon, low-waste policies and programs for our hospitals, our clinics, and other related facilities. We want to look at perhaps grants and other kinds of support for green infrastructure, such as green roofing and hospital garden efforts, which actually reduce energy usage quite a bit. We want to see policies adopted to reduce waste and pollution, for example, promoting organics, recycling, and food donation programs to reduce food waste in medical and healthcare facilities. We would like to see some sort of incentives, perhaps, or encouragement, something to bring our hospitals and our healthcare facilities around to adopting a pathway to zero carbon. I can't emphasize enough that Minnesota is a microcosm. This is a global problem. And yet what we do here in Minnesota, or don't do, is an example of what can be done and an example of what should be done that others will adopt. We have been, as I'm sure you are more aware than I, been leaders in the area of energy, clean energy production and energy energy efficiency, and we should proceed with that with all possible haste. I think that's those are samples of some of the policy recommendations that we prepared for Congress. We think many of these are relevant to Minnesota and to your work here. And with that, I'll thank you and everybody.
Thank you. And next we will have Teddie Potter from the University of Minnesota School of Nursing. And for the audience, as she's getting set up here, if there are questions, you can put put them on cards and either set them on the table or give them to Zach in the purple shirt. We're happy to pick, we'll wait and do questions at the end. So keep track of your thoughts. And I think Representative Mike Freiberg has also joined us on the phone.
Thank you so much for inviting us to be here. When a nurse is present, we bring the patients and the families into the room. And that's what I wish to share with you this evening. But thank you for your work in this area. It matters a great deal to all our people. My name is Teddie Potter, and I'm a professor in the School of Nursing at the University of Minnesota, where I coordinate the Doctor of Nursing Practice in Health Innovation and Leadership. And I'm also the recent appointed Director of Planetary Health for the School of Nursing. My colleagues did an excellent job describing the health impacts of climate change. But I want to use my time to discuss the impact of climate change on our well-being. The well-being of every single Minnesotan is threatened by climate change, and ultimately, our sense of well-being has a powerful impact on our health. I speak as a Minnesotan. My father's family has long and deep connections to southern Minnesota, specifically Lake City. The man sitting in the center of the photo is James Bradford, my great-great-grandfather. As a boy, he ran away from home to fight for the Union in the Civil War. Today, I too fight for the Union. Climate change has been used as a wedge issue, purposely dividing us along party lines. The health and well-being of all Minnesotans will be impacted by the climate crisis. Instead of being divided, we must work together to draw down greenhouse gases. I speak as a nurse. According to the World Health Organization, climate change is the greatest threat to global health in the 21st century. The WHO has also predicts that between 2030 and 2050, we will see climate change cause an excess of 250,000 additional deaths per year from heat stress, malnutrition, malaria, and diarrhea. Furthermore, the recently released 2019 Lancet report states the life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extreme weather, food and water insecurity, changing patterns of infectious disease, and a less certain future. Without accelerated intervention, this new era will come to define the health of people at every stage of their lives. I speak as a nurse. The code of ethics, the code of nursing ethics requires all nurses to address climate change and other threats to human health and well-being. So here are some examples of the ways climate change can impact the well-being of Minnesotans. You heard about the flooding, but it does impact farmers. According to the Department of Health, the rate of precipitation is growing at an escalating rate. As a matter of fact, 2019 was one of the top 10 wettest years in Minnesota's history. Research from Australia shows that changes in these weather patterns exacerbate farmers' worries about the weather, undermine their self-identity, and contribute to cumulative chronic forms of place-based distress, including heightened depression and suicide. Minnesota's warming waters also impact the quality of life for people who fish for a living and who recreate. And that cannot be underestimated, the power of that for Minnesotans. We love our fish, we love our lakes. Potential leaks from pipelines carrying tar sands oils can impact the well-being of indigenous people whose livelihoods depend on wild rice harvests. Pipelines do leak. In fact, on Halloween of this year, Keystone XL pipeline carrying tar sands from Canada leaked an estimated 383,000 gallons of oil in northeast North Dakota. This was its second big spill in 2 years. Solastalgia is a term that means profound grief from loss of place. We know that people who lived through Hurricane Katrina are still exhibiting signs of PTSD 12 years later. It doesn't have to be a climate disaster, however, to impact our well-being. Climate change threatens places that are part and parcel of who we are and our cultural identity. For example, aspen, birch, balsam fir, and black spruce are projected largely to vanish from the state by the end of the century. Can you picture a BWCA as an oak savanna? What does that do to our sense of being a people of Minnesota? Climate change is having a significant impact on the well-being of young people. Students in my classes at the University of Minnesota have expressed emotions of anger, fear, and hopelessness related to this changing climate. So this has impact on the quality of the life of the people. So we have an opportunity here. What are we doing? At the University of Minnesota, the health professional schools have worked together to create climate change curriculum. So every single health professional graduating from the University of Minnesota will be prepared to serve in a climate era. We also are involved in, the nurses are involved in applying science. Climate change is indeed a life-threatening crisis, but it's also a chance for an opportunity to change the way things work. The World Health Organization proclaimed 2020 the year of the nurse, and nurses are not going to stand by while climate change kills our people. Nurses are uniting to create change. Project Drawdown offers 100 of the most and best science-based solutions to drawing down greenhouse gases. It's the most comprehensive plan ever proposed to reverse global warming. So we've gotten together as nurses and are working with Project Drawdown to do Nurses Drawdown. And we're mobilizing nurses around the globe. And we have chosen 4 solutions that are our focus: plant-based diet, walkable, bikeable cities and appropriate mass transit, educating girls, and protecting forests and planting trees. These solutions not only help heal the planet, but they also contribute to improved human health as well. A few years back, I had an opportunity to visit the Provincial Assembly in Nunavut in Iqaluit, Baffin Island. I was inspired by the design of the Assembly, which arranges its representatives in a circle, each facing each other. In the middle of the circle is a traditional Inuit sled bearing traditional artifacts and imagery representing the environment and all its inhabitants. This sled serves as a reminder to consider the impacts that all decisions have on the people, the animals, and the land. You too have an opportunity to consider the impact that all legislative decisions have on the people, the animals, and the land. The health of Minnesotans, both now and for 7 generations to come, are depending on it. Thank you very much.
Thank you so much. That was great. And next we have J. Drake Hamilton from Fresh Energy.
Good evening. My name is J. Drake Hamilton. I'm the Science Policy Director at Fresh Energy. Fresh Energy is an independent nonprofit that shapes and drives realistic, visionary energy policies. We are practical. Our primary work is to speed the transition to a clean energy economy that benefits all. How do health and the economy benefit from energy efficiency and the transition to renewable energy? As we learned from the path-breaking 2007 Next Generation Energy Act, bipartisan policy can drive in just the first 10 years to curb greenhouse gas emissions from the electric sector in this state so far by 29% as of 2016. In the same first 10 years of the policy, Minnesota's gross state product, our economy, grew 29%. This is win-win. Renewable energy provides a chance to curb greenhouse gas emissions to lower the cost of electricity. It's also better for human health. Just last week, I reviewed an article in PV Europe. Renewable energy offers most benefits for health and the environment. It said, relying mainly on wind and solar would bring most cost benefits for the health of people and the climate. The main winner of decarbonization is human health. Switching to renewables-based electricity production could cut negative health impacts by up to 80%. This is mainly due to a reduction of air pollution from combusting fuels. The supply chains for wind and solar energy are much cleaner than the extraction of fossil fuels. The author of this study wrote, when looking at the big picture, The best both for people and the environment is to rely on mainly wind and solar power. But get this, a new tool from our current U.S. Environmental Protection Agency changes our planning for energy in the future from valuing efficiency and renewable energy as currently being valued at 0. The U.S. EPA, in July of this year, this EPA released the report, Public Health Benefits per Kilowatt Hour of Energy Efficiency and Renewable Energy in the United States. The EPA's goal is to help state policymakers to estimate the monetized public health benefits of investments in efficiency and renewables. Quantifying the health benefits of clean energy as dollars might be the tool that convinces policymakers at all levels to do more on this issue. The EPA, in their study, divided the value of those estimated reduced hospital visits and deaths from fossil fuels, for example, divided that by kilowatt hours of renewable energy generated. However, the EPA study only looked at health risks caused by nitrogen oxides, sulfur dioxides, and fine particulates. These substances contribute to heart attacks, asthma, and respiratory diseases, but these are only some of the adverse effects that should be considered to support development of more renewable energy. The EPA does not include the negative health impacts of carbon dioxide. That means the benefits per kilowatt hour of renewable energy I'm about to cite to you are underestimates. We're going to zero in on the upper Midwest region that we live in. It's Minnesota and surrounding states. Their results from the Environmental Protection Agency, between 6 cents to over 7 cents per kilowatt hour of health benefits for new wind and solar resources. This is not cost of the resources. For example, just look at Xcel Energy, which buys wind now for up to the low cost of 1.5 cents per kilowatt hour. So these really outweigh the cost. This tool does not include those climate benefits from reduction of CO2 emissions, but regulators can calculate the value of CO2 reduction separately and ensure that this value is included in resource planning and dispatch of this electricity. This now becomes an easy and clear means to assess how fossil fuel power plants harm human health. The benefits per kilowatt hour are listed by region and can be multiplied by the number of kilowatt hours saved from efficiency or generated from renewable energy in that region to estimate potential health benefits in dollars saved from projects. So consider these numbers. These are cents per kilowatt hour in 2017 US dollars for the upper Midwest. For energy efficiency, 6.2 cents of health benefits per kilowatt hour. For solar energy, 6.53 cents per kilowatt hour from utility scale solar and also rooftop solar generation. And finally, for wind, 7.23 cents per kilowatt for the wind turbines. Who might want to use these health benefits per kilowatt hour screening values? The answer is stakeholders interested in approximating the monetized value of outdoor air quality related health benefits of efficiency and renewables, including energy air quality and public health agencies, public utilities commissions, energy efficiency and renewable energy project developers, industrial organizations, non-governmental organizations. Our Minnesota PUC now uses as a shadow price essentially the social cost of carbon determined by the extensive externalities docket that started out way before my time, maybe yours too, in 1994. and that's close to a little over $42 per ton. Thank you very much to the Climate Action Caucus.
Thank you very much. What incredible information. And next we have Ms. Eleanor Dolan with the Youth Climate Strike.
Hi. So I wasn't originally going to start out my presentation with this, but as we talk, it just seemed more and more relevant to me about the statistics and how bad it can get. As a young person, my anxiety was skyrocketing over there, hearing just how terrible my future can look. That's terrifying, and I was almost trying to stifle a panic attack sitting there. And that's what's happening to all of us young people. We are petrified for what our future is going to be. Okay, now I'm going to get back to the bit I wrote. So, hi, my name is Eleanor. I'm 16, a junior in high school, and I'm also part of the U.S. Youth Climate Strike. And I'm here today because my generation is on the front lines of this issue, especially people like myself and my little brother who suffer from chronic illness. And I'm here to put a face to these statistics. I'm also here because when we talk about health and the climate, I feel like myself and with chronic illness and people with disabilities need to be leading this conversation as well. In general, I just fear for my future and that of the rest of the humanity. And I'd like to start by saying that although I'm here to discuss the way the impacts of the climate crisis heavily burden people with chronic illnesses, such as myself, I also have immense white and wealth privilege that does limit my exposure to these effects. That being said, people with disabilities and chronic illness are at a higher risk than the general population when it comes to climate change and its effects. And we need to be including disabled people and chronically ill people in our solutions, uplift our voices, and help those of us already affected. So just to give you a little background on what the Climate Strike is we are a student-run organization that uses direct action to demand systemic change to solve the climate crisis. Our last strike had over 7,000 people in attendance, and we have our next strike this Friday at the Capitol. I'm going to plug that here real quick. Basically, what we're demanding there is for the State Board of Investments to divest from fossil fuels. And if you'd like to join us Friday or learn more about what that means, I'd be happy to connect after the panel. Okay. Before I get too far in, I'd like to share why I specifically care about this issue. Like I said before, I'm 16. There are so many things I want to do in my life, go to college, have a family, get my dream job, or even just experience more what life has to throw at me. But climate change has stolen that. I don't know what the future holds for me. In fact, some days I don't think I'll have one. I have to wonder, how will climate change affect my symptoms? Will I get sicker? Climate change has already stolen my present. I'm here on a school night talking to you, not doing my homework. I'm skipping ski practice or trying to start some sort of social life between everything I do. But it's not just me though that I'm worrying about. My biggest fear comes from my little brother. My brother's name is George. He's 12 years old. He's in 6th grade and he's crazy. And he relies on a daily medication to keep him alive. Every day he takes meds that keep his symptoms at bay, and we always have to be near a hospital in case something goes wrong. In a natural disaster, where will he go? What will happen to him? What will happen even in the less extreme effects when he already bedridden with asthma on occasion, when that increases? Will he be able to have any quality of life? What will happen when his already weakened immune system is exposed to diseases frozen in ice? Will he be left behind as the world burns? I'm terrified. As his older sister, I feel like it's part of my job to protect him, and there's nothing I feel I can do. And then, of course, mental health has a factor in this. My generation has a lot of mental illness, and I'm certain that the uncertainty of our future plays a role. What's the point in getting an education when we'll die before we'll need it? Why care when adults don't seem to care about us? I've struggled with mental illness, as do all my siblings and the majority of my friends. A casual hangout turns into an existential crisis every time anyone jokes about the future they may not have. Climate anxiety is real, and it should have been expected. I've grown up not knowing if I have a future. How do you expect me not to be anxious and depressed? Climate change is attacking our health in all areas, mental and physical. We're already inhaling, drinking, and eating so many toxins. If we do get a future, how will that affect us? And what happens to us, the generation that grew up in a dying world? Okay, I did think of some things that I've cared about wanting to solve this. So one thing is improved responses to disaster that prioritize the people most at risk. We need to make sure disabled and chronically ill folks get the medication and medical treatment they rely on quickly after disaster strikes. And in the climate movement, this is not something widely discussed, but it's of huge importance. We need to discuss how we respond to disaster to prioritize the people most at risk. But this is just a Band-Aid, and what we have here is a much bigger issue. The climate crisis must be solved. This means radical action. We do not have time to compromise. 2030, that is your deadline. That's what science says your deadline is. You cannot make political compromises. If you do not reach that, I don't have a future. And we need to go carbon neutral, and as well as address the root of this issue. And that root is the systems that continue to exploit people and resources and produce excess waste. Our Earth is not a limitless resource, and we cannot have limitless growth. For example, once we deal with this, maybe we should deal with the effects of pesticides with another world-ending crisis, the extinction of pollinators. This is a systemic issue that needs to see more than just Band-Aid changes. I don't want to spend my life fighting the end of the world while billionaires continue to exploit the earth in different forms of profit. And part of this is also a just transition. As we bring this renewable energy, we cannot leave any communities behind. It cannot only be accessible to some. And our solutions cannot just work for the able-bodied, high-income, white Minnesotan. It needs to work for all. The systems are failing us, but we have an opportunity to dismantle them and build a more just world. People with chronic illnesses and disabilities are on the front lines of this issue. Listen to us, include us, support us in what we do. And together we can make some lasting systemic change. I like to conclude by saying that if we don't do anything, reports say society could fall into total collapse by the year 2050. To put that into perspective, I'll be 47 when that comes.
Thank you. That was very powerful since I'm older than that. That does put it in perspective. Thank you. That was good. We're going to transition into some question and answers at this point, and I have one to start out with. And Ms. Hamilton, you talked about the health benefits from transitioning to renewables. I'm curious if there is if there's been any research that's done on an annual basis on the health impact costs, the costs, financial costs of health impacts from climate change, either in Minnesota, the upper Midwest, the country, if there are any of those kind of statistics out there, how much it costs today?
Yeah, there's been a study for the country as a whole, and that is at least $1 billion a year, increasing to $3 billion in the next few decades, at least.
Mm-hmm. Thank you. And so let's see, Representative Long.
Thank you. Thanks very much to Representative Acom and Morrison for pulling us together for this. My question is for anybody, but I think speaks most specifically to Jay's comments on what we're using to measure the health impacts of climate. And we often talk about renewable energy in particular when we're looking at the upfront cost, and we too infrequently talk about the health impacts and the lives saved by moving to renewable energy versus coal and other fossil fuels. And for Minnesota, I'm curious what data we're relying on when we're making health judgments about renewable energy. I know that the Public Utilities Commission has a social cost of carbon. Are we relying on EPA, or do we have our own independent analysis that we're doing? And you mentioned the EPA study from the summer, which sounds like it was a positive step, but we also know that EPA is moving backwards on a lot of science and has dismantled some scientific advisory committees and is also attacking a lot of public health science and trying to get rid of some studies they don't like by saying that we can't have studies that have private health data. And so I'm curious if we can still continue to rely on EPA health estimates or if we have to develop other methods.
Well, I think it was great news that the EPA came out with this in July of 2019. Very good health data. And they were pointing to the fact that the vast majority, perhaps, of the state and local policymakers around the country value this health benefit as zero. And I'm really glad that the Minnesota legislature directed the PUC to do an externalities study and to incorporate that now. And that is now used as shadow pricing for all of the resource planning that goes on there. But that's not, doesn't hit all of the utilities in the state, of course. And the vast majority of utilities don't go through the resource plan process. And so you can't have the check there that's being very nicely overseen by the PUC in looking very carefully at each utility's roughly every 2-year resource plan. So it's not a matter of throwing out the really good recommendations from the PUC and from the EPA, but to take that information and get more people talking about all these many benefits of the health benefits, because there's so much greater than the costs of renewable energy. And it's like a freebie. And we should get a lot more of the agencies that are now on the sub-caucus of climate action for the Walz administration to talk about in their own jurisdiction what this health benefits could do for us and how we get more of the renewable energy and energy efficiency. Because what we have learned so far from one of our students has brought to our attention is that this is really a bad existential problem for all of those young kids. And what gives me hope is that we have moved forward so far in the electricity sector, or parts of the electricity sector, and now we need to commit to getting that whole sector off carbon and get it carbon-free as soon as possible. And then we need to plug everything in our homes and our buildings that could run on electricity and not on coal and not on natural gas, get it shipped over. So there we have two of the very first things that we should all be working much harder on. These health benefits numbers are extraordinarily good news, and we need to make that good impact happen to more parts of Minnesota and the rest of the country.
Could I add a comment? I did see that report, and I feel that the figures of $1 to $3 billion per year in health costs is a vast underestimate. First of all, if you consider that rising average temperatures impact labor greatly around the world because people are too sick and affected to work on their farms and in their fields and in their factories and so forth. There's a lot of cost related to a loss of productivity. Also, I think it was in 2014, the Department of Health did a study, I think it was Life and Breath report in 2014, which was able to assign a percentage of metro area hospitalizations and related and deaths to air pollution, so cardiopulmonary disease. And so first of all, that study should be repeated, and it should be extended statewide. And what you'll find is that there's a significant burden about when you take a child with asthma, or an adult for that matter, and you begin to figure the costs of missed work, missed school, emergency room visits, and the costs of the medications involved, you really have to have a large focus to pull out what this is doing to us. And to echo Eleanor, the mental health impacts of climate change, both in terms of storms and floods and heat, as well as the generalized anxiety in the population. This is expensive. people are using mental health resources. More resources need to be developed. So these are expenses which I don't think were adequately accounted for in the EPA study.
Thank you for that clarification. And next on the list, we have Representative Raymond Dean.
Thank you, Madam Chair. And I have a question, and maybe you can answer this or maybe you can't answer it. Is there anyone that's done a study of sort of the overlap of several things, whether it's air and water pollution relative to us living as a species, the increased global population, the possibility of our agriculture monocultures and how they'd be susceptible to pests or diseases because of climate change? I mean, I think that using the word catastrophe is not too extreme, and I'm surprised that none of you, and maybe because it's really hard to talk about, is the possible extinction of the human species.
I'd like to take a crack at that as the Director of Planetary Health. Planetary health is a new understanding of health, and it's the intersection of all the things that you mentioned: the collapse of our fisheries, overpopulation, resource degradation, water problems, soil problems, and the intersection of that. As a nurse, I would say we're in multi-system failure. And multi-system failure is really, as you say, life on the edge. And we don't know when a human's in multi-system failure if they'll make it. The planet is in multi-system failure, and it's requiring all of us with various pieces of knowledge to come to the table at the same time. The area that is working on planetary health is the Planetary Health Alliance out at Harvard. They have a whole group of organizations that they represent that are in the alliance, all working on these issues, and it's a global approach. So yes, you hit the nail on the head. Climate change is but one of the symptoms right now of the results of treating the environment poorly.
All right.
Just a quick little follow-up.
Please.
I think it's amazing that we're talking about pennies and dollars and things like that when we should be talking about what's the right thing. And unfortunately, I think we've gotten to a point that we have to make the economic argument to do what's right. And as long as we keep sort of using that lens to do what's right, I think it's going to become real hard to do what's right.
Absolutely.
Yeah, you're all good. Next, we have Representative Wagenius.
Thank you, Madam Chair. I'm thinking about the Health Department talking about flooding, and that's going to be very real. And flooding is going to impact private drinking water wells, municipal wells, surface water that's used for drinking water. Does the Health Department have let's assume they do. What is your plan if there is a big flood to make sure everybody's drinking water is okay?
Thank you, Madam Chair. So the Minnesota Department of Health regulates public water supplies, and it also regulates the construction of private wells. Private wells are not regulated by the Minnesota Department of Health. That is, it is up to the owner of the private well to actually test that well and treat that well. So there are plans in place that look at protecting public water supply. We did a vulnerability assessment recently looking at private wells that are located in flood zones to identify areas where private wells may be impacted by flooding. A lot of the work that goes into protecting wellheads and public water supplies are partially helped by the Minnesota Department of Health, but also at the local level. So it's kind of a joint collaborative effort.
If I could follow up. You've raised a huge equity issue. So you're saying that folks who have public water, you will do something there, though I would challenge you that most of our wellheads are not protected, and you certainly gave up the Mankato example. But private wells, it's a public health issue. You are the public health agency. And to say you don't have authority, what you are really telling us is you're only looking at your authorities under the federal law, but you have broad authority under state law to protect public health. So it seems to me that we need to spend some time looking at how the health department will respond when private wells, say in the karst area I'm most concerned about, or the sandy areas in Minnesota, and we have lots of those, we need to have a way to deal with folks who are going to have less money probably, or certainly some of them are. So the fairness issue here just jumps at me. And I think we are going to have to spend some time on that issue.
Yeah, good point. Good point. Did anyone else want to respond?
Just a quick note that the connection between fossil fuels, and particularly coal, and water pollution, I think, are exemplified by the findings in a Department of Health study, which I think was about 10 years ago. And what they did is they studied umbilical cord and blood mercury in infants born in the greater Lake Superior Basin, and found that about 10% of infants had elevated blood mercury levels. Mercury is a neurotoxin. They did not have, the study did not do delayed developmental milestones, but I strongly suspect that there were deficits related to that mercury. Mercury is bioaccumulated in our food chains. Concentrations in loon eggs are sometimes tens to hundreds of thousands of times that in the surrounding water. The direct connection between our coal plants, where the mercury is generated, and what's happening in our water.
Yeah, good point. All right, next we have Representative Kelly Morrison.
I have to add that it concerns me that we're talking about doing copper sulfide mining in that same area, because that will also potentially increase mercury in the water. But my question was for Professor Potter, more evidence that nurses rock. I did not know that was in the Nursing Code of Ethics to address climate change. That's very cool. I'm wondering if you'd repeat the 4 things that nurses are concentrating in on Project Drawdown.
Right. Our solutions in the Nurses Drawdown, we've chosen diet, plant-based diet, and in that we're also decreasing food waste, focusing on decreasing food waste, and in the Global South, clean cook stoves. For the transportation and mobility, we're looking at mass transit, bikeable, walkable cities. We're looking at educating girls, because that's actually number 6 on the science-based drawdown solutions. And then, and certainly in a profession like ours, that makes sense. And then the 4th one is that we are really supporting afforestation and protecting our forests.
Thank you. I thought that was bore repeating. I appreciate it.
Thank you.
Let's get back on the list.
Okay, excellent. Back on the list. Representative Hornstein.
Thank you, Representative Aiken, Representative Morrison, and all of our guests. We really appreciate your being here. I think this would be for either Ms. Potter, Mr. Snyder, or both. Are you finding, I'm just pleased that we now have organizations of health professionals. What has the response been from your peers? Is this a growing concern? Is it discussed at professional conferences? And then I think then as a follow-up, are we seeing any curriculum in medical schools and nursing schools, or people are studying to be physician's assistants? I mean, is this sort of entering kind of the broader mainstream of the healthcare professionals, and what's the response been?
Well, I can say it's very exciting. We are a science-based professions, so when the science speaks loudly and clearly, and 99% of the world's scientists agree, we take that very seriously. And so the evidence is there. There is the Medical Society Consortium on Climate Change and Health, which represents, I think, over 150 maybe, large health professional organizations. And there was actually a 2019 call for action on health policy and equity related to climate change that was released in July and signed by many of the large organizations. There's the Global Consortium on Climate Change and Health, which is another than the health professionals globally. As I said, at the University of Minnesota, we have curriculum, and we're one of the first universities that have created interprofessional curriculum for all the health schools. Wall Street Journal picked it up, the Washington Post picked it up, because we're leading in this area of creating curriculum. I have not found any nurses that personally have pushed back when we've talked about this. In 2014, when I marched at the People's Climate March in New York City with 500,000 other people, I wore just a plain T-shirt, but I had a Shape of Minnesota, a sign that I carried, and it said, Minnesota Nurses for a Healthy Future. And as I walked down that street, people came out of the crowd. The nurses are here, and wanted to take pictures and wanted to be, to say that the nurses are in on this. So speaking from our profession, absolutely, we're going strong on this.
And very quick, Madam Chair, thank you. Just a very quick follow-up then, and unless Mr. Snyder.
There's conferences, there's organizations, there's webinars, there's policy statements, there's scientific warnings, there are journals, and it's not getting out there. It's the echo chamber within the health and science bubble, if you will. What I've been disappointed about is that our healthcare organizations, think about our healthcare insurers and clinics and for that matter universities, are not publicly stating and advocating for what is possibly the most important issue that any of us will ever face in our lives. I've been trying to get the MMA to make public their feelings about climate change for 5 years. I got them to adopt a policy statement on it in 2014. They will not make a policy statement. They will not use their capital connections to advocate for clean energy policy. So there's a problem here.
Right. Thank you. That was my sense, and I think there needs to be a lot more action. But very quickly, Madam Chair, I know you want to get through here, but if you could, maybe Ms. Potter, just briefly describe the curriculum. I mean, this innovative curriculum at the university. But what are the students learning about?
Absolutely. Much of what Kristin had to share with all of you, very briefly, succinctly, the health impacts, how to protect our citizens. So when we have vulnerable citizens, how to protect them and ensure that they have cooling centers to go to when it's hot out. What are the plans when there's ice? What are the plans for them in a flood situation? How are they going if they have respiratory conditions? So a lot of it's focused on prevention, having safe places, having plans in place, but also recognizing that this is an issue. So they will suspect a tick-borne illness. They will suspect that their respiratory condition might be related to the increased allergen time frame. So,
thank you, Madam Chair. Thank you.
Yeah, absolutely. And as we're continuing on, one of the things that are the objective of these meetings is that there are actionable items, and I didn't give Representative Lee a heads up that I'm going to do this, but he has a bill that he's working on, and I thought this might be a great opportunity for him to share a little bit about it, just because this is kind of the goal of these meetings and our caucus as a whole. And so, Representative Lee, would you be willing to share a little bit about your bill?
Thank you, Madam Chair. And so the premise behind the bill that I am working on and that I would like to ask all of my colleagues around the table to sign on to was a result of, many of the members here who serve on the Capital Investment Committee as we travel throughout the state to look at, different public infrastructure projects and what we should be funding. And one of the issue that came up was to Representative Wagenius' point about the rising water and flooding that we are facing and the different local communities are facing. And so What I'm proposing is to have the Department of Natural Resources to coordinate with other agencies like Department of Health, MPCA, and Bowser to assess the impacts of climate change, including the increase in heavy precipitation and storm events on state-owned assets, and to estimate the capital funding needs associated with those impacts, because we're seeing that, you know, this upcoming year, we're going to have a bonding bill, and that's going to be hopefully it will be over $1 billion in public investment. And if we're going to invest in that amount of money, hearing some of the testimony that you have provide, that's very significant if we do not really look at how could we move towards a transition to clean energy with regards to these public infrastructure projects. In addition to just looking at the costs, you know, we're talking about how do we quantify the public health costs, and I really hope that, you know, this will be a conversation starter for the different agencies involved to start seeing how could we work to address this climate crisis that are not only impacting us, you know, with regards to capital funding requests, but to, you know, our well water, our wastewater facilities and all of that too. And so, Madam Chair, just very briefly, that's what my bill aims to do, and I hope that I could get the support of members of the committee.
Well, thank you for sharing that. And I do think it's important that as we're looking at state investments and tax dollar investments, that we're making sure to use them wisely and not be adding to the problem. And so I think that's a great step in that direction. And so next on the list, Representative Bierman.
Thank you, Chair Acom. Thanks for having this event tonight, and I'm glad I came. There's so much good information coming out here. I appreciate the panel, and some of my questions, as others have asked, have come out already, but I did want to go back to Ms. Potter regarding the doctors again. That was one of my questions about what they're being educated with. And then I know the powers of nurses, and I was in the hospital twice last year, and I wonder if you could do something about the food in the hospitals.
Maybe it will take a law to do that.
Yeah.
Well, then that's the next thing. I appreciated the comments about, well, Rep. Dean brought them up about, you know, it shouldn't be just an environmental argument. But in the last year, I have found that the economic argument, it shouldn't be just environmental economics, but I have found that that's one of the most powerful, you know, arrows in my arsenal when I am talking to people about climate change. They don't want to talk about climate change, some of them, but they will acknowledge weather changes, especially, you know, more rural folks or just conservatives in general. I had a coffee hour last week where I was challenged by a bunch of Republicans who decided to come crash my coffee hour, which was great. I love to have them there, until one of the gentlemen said that there is no rising water. Miami streets are flooding because the buildings are so heavy they're sinking the ground. And so I asked him to back that up, and he left shortly thereafter. But that's what we're up against. And I think yesterday I read an article about Ohio legislators who have passed a bill in Ohio that if somebody is basing their research in school on their beliefs rather than science, that's okay. And so, you know, we're up against all sorts of ignorance about the issue. And so I was glad to hear tonight the whole chain from Ms. Hamilton about the cost of health impacts, et cetera. And I think one action item for either this committee or for, we have the vice chair and the chair of the climate change committee here, if we could get some fundamental numbers that we could actually use that are solid, that are straightforward and not complicated, where we divulge into, you know, all the aspects of it, that would be extremely helpful going into this next year. And I think it would be very useful. Maybe I'll have a question coming here. I'm just kind of replaying everything that went through my head. I did want to share with Ms. Dolan, thank you for being here tonight. You sat up there, and I was thinking about when I was 16, what I was doing, and you brought up a lot of really good issues, which, you know, I've known about, but you gave me more depth to them now, and I think they were very pertinent. I've met a few young people who told me they aren't having children because they just fear for the future. And I did want to share with you, though, that older folks like myself, we have panic attacks now, and a lot of mine started in the last year thanks to Chair Wagenius and all the speakers she brought into climate change last session, and they've only been getting worse. So we're in this boat with you and working toward those solutions. So thanks for being here and sharing your thoughts on that. I guess that's it. I had action steps and a bunch of comments, so.
Nice, thank you. And Representative Wagenius?
Thank you. I was remiss in not following up when we were talking about the Department of Health and the response to floods. There was the question of drinking water, but there also the question that Ms. Dolan brought up about folks who are vulnerable. Yeah. So I'm thinking about the water they're drinking, but also the issues she brought up and how, do you have protocols in place to help? And if not, what's the plan for getting those protocols?
Thank you, Madam Chair. So there are a number of issues that were brought up, and one of them was around emergency preparedness. And MDH has a robust program around emergency preparedness and works with a lot of local emergency managers throughout Minnesota. We recently did some profile reports that look at climate change data and vulnerable populations in different homeland security and emergency management areas so that those emergency managers and emergency preparedness folks could understand better what to plan for in their communities. So what kinds of changes are happening in their communities, who are the most vulnerable populations, so they're able to develop those strategies to help protect those populations. So that is being worked on. I will say that we lack a lot of important data to make some of these decisions. One of the sets of data that we lack is dynamically downscaled climate projection data, which is a big mouthful, but basically that is an important data set that will tell us, will better predict what our future holds for us here in Minnesota, depending on different climate change scenarios. And without that kind of information, we do not have it for Minnesota. We have statistically downscaled data, which is not the same as dynamically downscaled data, because dynamically downscaled data actually puts inputs of physical processes and geography from Minnesota within that context. So we are doing plans. We're working with the state emergency management program, and I'm not sure if folks are aware, but they have put climate change in on our state hazard mitigation plan, as well as thinking about those vulnerable populations. There's still a lot more to do. There's always a lot more to do, but we do lack some important resources to make those things happen, and getting dynamically downscaled climate data would be a big resource for us to do better planning.
Just so members here, I think probably every one of you voted for the money for that. That was in the bill that we had. So we hear that, we voted for it. We just need to persuade the Senate that they need to also vote for it. In terms of expense, members, it's one of the least expensive. In the scheme of things, it was $547,000. And we were getting the used supercomputer for free. So it was a super good deal. So we get that, but I'm still sitting here worried a lot about drinking water and the vulnerabilities that Ms. Dolan brought up, because I don't think we have the specificity that we need. I mean, how can Homeland Security even be talking about security if you don't even have drinking water?
Madam Chair.
Yes.
So I should just clarify, I don't work in the drinking water area in the health department, so I am not the expert in this area. But I do know that the emergency preparedness area at the health department works really closely with our water section. And so they're definitely thinking about this. So, maybe there's more planning to do, but we are trying to provide as many tools and resources available to the local units of government and the local emergency managers to help plan for climate change.
I think, Madam Chair, if we could at some point talk about all the folks who are not being addressed, those particularly with private wells, and I don't hear anything about people who drink surface water for drinking water. So I'm concerned on all three counts.
Yeah.
So.
Yep, noted. Next, we have Representative Waslewick, and we've got a few more questions to go. And if there are any questions in the audience, please pass in your cards if you have any. Yes.
Thank you, Madam Chair. I just have a question. I think it's been brought up a few times, Representative Bierman and Representative Wagenius, about opposition to addressing climate change. And I think, some of the opposition is that we're not even dealing with people who necessarily believe in science and facts. So I'm wondering if maybe someone could speak to how we can't do anything if we don't have the people who believe it's real and that we need to do something about it in positions of power. So how do we I guess my question is, how do we convince folks who don't believe in it what sort of information is helpful or what sort of messaging is helpful? I think the economic argument works for some people, but I still think we're dealing with people who don't necessarily believe this is a thing that we need to tackle. And I know that when I said in an e-update that I was joining the Climate Action Caucus, I got pushed back too. So I know that it's not just a broad idea, it's happening everywhere. So I'm wondering if someone could speak to some of those issues.
Maybe I could say a few words. Surveys over the past 10 years have shown a shift in American public opinion towards a majority now believing in and worried about climate change. Yale has a center, and I'm forgetting the exact name, but I could get it for you, that does these surveys periodically. The position of many organizations is actually that we are not going to convince climate deniers, and that working with those who accept that it's real and are concerned about implications. So that the climate deniers, such perhaps as those that showed up at your coffee, really are losing relevance. Another piece is that climate action has gotten caught in a matrix of political, social, and economic issues. It really has nothing to do with gun control, family planning, and a variety of other issues that people are very divided on. And one of the challenges, I think, to our public officials and public figures is to try and understand a way to isolate it, to draw it out of that matrix and clean it up.
If I could add to that, Columbia has some very nice work on climate communication. And one of the leading things that people pay attention to is the health impacts of climate change, far and beyond the economic impacts. So leading with health will oftentimes get ears to open that are not opening. And I think Dr. Snyder was referring to the Yale's project on the 6 Americans, which they measure every year the percentages. And those percentages are shifting towards people that are alarmed and concerned. And so if you look at the spectrum of allies, which shows we tend to want to put our energy into the people that aren't with us or are deniers, as he said. That is a waste of energy. You want to go to the next group over, the people that maybe understand climate change is real but are scared and don't know what to do with it. Perhaps the neutral folks that it could be, I don't know. Work on those groups. When that group gets large enough of a cohort, some of the others start to shift over. And the deniers that are purposely against you and are trying to thwart your work, they will always thwart your work. It doesn't matter what you do, they're always going to thwart it. So pull in the allies and activate those groups.
Dolan,
Representative, the State Climatology Office has documented that there's no realistic emissions scenario under which climate does not continue to become warmer and especially wetter through 2050. What I've found is, rather than trying to confront climate deniers, it's much more interesting to talk to people in the government agencies who have some expertise on climate and are gathering real stories in Minnesota about the wetter year, this year, is really damaging people all over Minnesota. And people who have never noticed it before, if they live within visibility of a stream or a lake, and they can point to how high that lake has historically been, and now it's in their basement. It freaks people out, rightly so. And so we need to gather these stories and push them out effectively. Because it's not about really so much talking about climate. It's talking about the damages and helping other Minnesotans deal with that.
Ms. Dolan?
Yeah. So one thing that we've really found as like the climate strike is that there is a high number of people who, especially in the inner cities, who just feel like the climate is not their biggest issue. It's more of like a hippie, I want to go out and go camping and go in nature and stuff like that, and I'm sad it's getting destroyed sort of issue, when in reality we're really trying to shift the narrative onto like, no, this is in your inner city, like it is affecting primarily low-income people and people of color. It's due to this factory. It is changing your like style of life, your like quality of life, and it's major, and it's really, and that's where we've really gone like a lot more support than I think it's gone in the past, is in those inner city communities where typically where we're trying to change the narrative to really show like this isn't a like white issue or like a nature-y, like hippie is what we typically call it issue. It's definitely something way more serious and way more relevant in your lives.
Thank you. Okay, so we got 3 more questions and a couple from the audience and just a few minutes. So if we can be as quick as we can, that'd be awesome. So next is Representative Dell.
Thank you, Madam Chair, but I know time's getting late, and I know you have questions from the audience, so I'll defer until our next meeting because my question is longer than...
Okay, hold that question then. All right, Representative Herr.
And I'll try to be quick too. I mean, you know, there was a lot of great information presented tonight, and as I was listening, I just was a little bit. There was just something that was sitting in me thinking about how the conversation we're having, are we really looking at the work that we're all doing with an equity lens, right? When I think about even, which I love the nurses' plans, but when I think about like the ways we've created within our own cities, you know, bike paths, but we create bike paths for people who have the financial resources to have $1,000 bikes to bike around a city for leisure, right? But in Black and brown communities, we bike because that's the way we get to our job at the gas station or at the supermarket. And so how do we look at the things that we are doing in which the plans that we are making really take equity into that framework? And I did a tour of the Mississippi River in my own city because I wanted to know what was happening and what I was being told around the way the sewers come down into the sewer stations. And when the water floods, they have to sort of protect those areas because even though St. Paul's water and sewer are separated, many other cities, their systems are still sort of intertwined. And what really concerned me was that the greatest impact would happen, whose sewers come down into the area, it's the east side, and that's where most of our poor, we have large poor Black and brown communities. And what does that mean when we look at the climate change work that we're doing and really look at this as climate justice? And so all of the things that we do, have we then applied that lens to it and the data that we're collecting? Are we then putting the nuances that we need to really understand the true impact of climate change on poor communities and communities of color versus those who may have the ability to mitigate what's happening with climate, right? Because those who are poor may live in houses that don't have central air or don't have air conditioning, and so they're the ones that are greatly impacted by what happens when when our world is heating up, right? And so I was just curious as to how, if all of you are sort of taking some of that into your work and how you're collecting data or the information and that you're all doing, sort of using that lens on that.
And that's a huge question, but if you could be brief in your response.
And maybe you can even, maybe we can talk later, or you can send me some stuff, or, if that makes it easier, because it is a very big topic, and so.
It's part and parcel of our climate communication and curriculum, and that underrepresented communities are going to experience it, are already experiencing it worse and first and worse.
A place to start is to look at experience elsewhere. The 1995 Chicago heat wave, when for example, in low-income communities, fire hydrants were opened and water pressure dropped. There was no running water. Isolated elderly were afraid to open their windows and doors because of street crime. Look at New Orleans and New York's Katrina and Sandy. Well, wellness checks were last done in low-income neighborhoods. And transportation options for evacuation were extremely limited in low-income neighborhoods. So look at that experience, and that will give you something to take off on.
And last question from member Representative Stevenson.
Well, thank you, Madam Chair, and I will share the commitment to be brief. I just have been really struck throughout the conversation about about the focus on mental health and anxiety in particular, starting with Ms. Dolan's really compelling comments and continuing through Representative Bierman's shared comments. And there is a lot of anxiety on this issue, and I think you can see it in some unexpected places. You know, rural suicides are at an all-time high right now, and we see what's happening to our farming economy as we're having a lot of trouble planting and getting crops out of the ground due to extreme weather events. I heard this morning on the radio about life expectancy, being stagnant or dropping in large part due to people taking their own lives during the rising levels of anxiety caused from a number of different areas. And, to me, a lot of anxiety is driven by uncertainty, and it strikes me that a big way that we can help alleviate this is by having a plan to move forward and taking some of the uncertainty out of the equation. And I think this ties in, I wanted to mention it because I think it ties into the conversation we were having about opponents to taking action on climate change, because a lot of what that opposition comes from is also about anxiety. It's about fear of losing, of economic loss and losing a way of life. And if we can put ourselves on a path forward that makes sense, you think about people who work in the skilled trades who have built a career out of building our existing fossil fuel energy infrastructure. But we're going to need to build a whole new energy infrastructure in Minnesota. And those jobs can be built by our existing skilled trades workers if we make that commitment, and if we work hard, and if we have a structured and just transition. We can provide a tremendous opportunity for our skilled trades and alleviate a lot of the anxiety that maybe is fueling some skepticism in those sectors. And so I think that there's a real opportunity when we focus on trying to come up with a just and orderly transition to relieve some of the anxiety across the entire community. I don't know if there was a question in that.
Well,
Sorry.
it was an interesting comment because it related to a couple of our audience comments too about kind of the mental health piece and how it relates to all of this and how we're going to address all of that. And so any brief responses to that?
Madam Chair, I just wanted to mention that we are doing a study right now of mental health care providers and what they're seeing in their clinics right now related to climate change. We're receiving that data back right now, and so we'll be doing an analysis very soon. So I think we'll be able to put some concrete numbers to what people are experiencing, what they're talking to either their therapists or psychologists around those mental health impacts.
Yeah, thank you. Well, we are a few minutes over, and so I think we're going to wrap it up, but maybe people can continue the discussion after if that works. And before we leave, I want to shout out to some of the University of Minnesota youth group, or student groups, that came. Health Students for a Healthy Climate, thank you. I see Jack back there. Minnesota Environmental Engineers, Scientists, and Enthusiasts, Gophers for the BWCA, and Youth Climate Strike members. And so thank you all for coming, and thank you, all of you, for being here, and our panelists especially, and to the Climate Caucus as well. So thank you, and the discussion will continue.
Ms. Dolan, when is the
Oh, yes, let's talk about Friday.
demonstration start?
Yes.
All right.
Details.
So if you want to join us Friday, we'll be in the Capitol at 3 p.m. And yeah, and if you want to join any local actions too, especially if you're in like the West Metro or anything, West and North Metro, they are having a climate justice workshop where they'll be talking a lot about the disparities in climate change and how it creates even more of those, as well as and stuff like that. So I think that's at the Ridgedale Library at noon. And we also have our Instagram is MN Climate Strike, I think, or I'll have to check on that. But yeah, and you can find all the details there.
Super. Well, thank you.
Thank you.
Thank you all for being here. We are adjourned.